what is the thesis or theses that you have around health or healthcare or healthcare systems, and how did that thesis or how did those theses influence your choice to help found a company?
One of my original epiphanies about healthcare is that it is a two-sided marketplace like so many others in other industries. And that means that there is a supply and a demand like any other industry. In healthcare specifically, though, the supply are the medical providers. And they've been the supply for hundreds, if not thousands of years, all the way back to the days of the village shaman and the villagers. And the demand are those villagers, are those people in the shaman's villages that get sick and need their knowledge or care. And if you think about it that way, then you realize that everything else, industrialization has constructed around this supply and demand is they're just artifacts, they're support systems for what's become. And so if you distill healthcare down to the fact that it's just these two parties, the providers and the patients, the consumers and the doctors, however you want to label them, what you realize is that those are the only parties that ultimately matter. And as long as you serve them and serve them both equally and well, you're going to do right by the system. So the other theses, or the theses that comes together out of all of this, is if you're really going to create true disruptive change in healthcare, create a solution and speak directly to those two parties. Because if you're going to create solutions for the middlemen or the ancillary institutions in the value chain, let's call it, um, and I don't mean to marginalize what payers and providers and pharma and all these other institutions are and what hole they fill in the system. All I mean to say is that they have become the powerful institutional incumbents. And it is in their interest to keep things that way so that they stay in power. And if you really want to see true change, what you want to do is fundamentally change the way consumers and providers interact and transact. And in healthcare, that transaction means an exchange of knowledge or an exchange of care.